Does being overweight increase your risk of having pain? Well, the short answer is yes, as I'm sure you all figured out from the title of this video. But maybe not for the reasons you think, because it isn't just about the weight on your bones and joints. And while it is true that losing weight can reduce mechanical stress on your body, this is not the entire reason for pain in those who are overweight. Hey everybody, welcome back for another episode of Physio Show. Besides increased mechanical stress, researchers are finding that there is also a strong metabolic component to pain in those who are overweight. This condition is known as metabolic syndrome, which is a result of excessive adipose tissue, leading to a chronic state of inflammation. So it's not just about weight on the body, it's also about chemistry. Adipose tissue are fat cells that act as storage units for excessive energy, but they have another function that you may not be aware of. These cells are actually considered a metabolic endocrine organ, which is biologically active. Think of them as mini factories that produce a variety of proteins and hormones, many of which are pro-inflammatory mediators, which promote an immune response and result in a low level of inflammation. So the more adipose tissue you have, the more factories pumping out proteins that cause inflammation. And while the body can manage a low level of inflammation for a short period of time, chronic inflammation can have serious consequences. Over time, this surge in these pro-inflammatory proteins eventually leads to injury to the cartilage cells in the joints, known as metabolic osteoarthritis. As the joint continues to be bombarded by these harmful pro-inflammatory factors, the joint further degrades. And remember, this is a systemic issue, meaning that the entire body is being attacked, not just the joints. This can lead to other chronic diseases such as type 2 diabetes, high blood pressure, heart disease, and fatty liver. Managing metabolic syndrome requires a multifaceted approach that encompasses a variety of strategies to improve outcomes and overall health. The first key is making changes to your diet. The goal is to eliminate or drastically reduce the consumption of saturated fats, refined sugars, and processed foods. These items contribute to weight gain, insulin resistance, and increased inflammation. Focus should be on incorporating whole grains, fresh fruits, vegetables, and lean sources of protein into your meals. Basically, if you can't pronounce the words on the label of the foods you are buying, then it's likely not good for you. So shoot for foods that have labels with recognizable ingredients and limit your intake of highly processed foods. Also, vitamin D deficiency has been shown to be associated with knee osteoarthritis development and progression, and there is some evidence that vitamin D supplementation may hold potential benefits for managing osteoarthritis, particularly in individuals with deficiencies. Regular physical exercise is another essential component. Engaging in regular physical activity helps burn excessive calories and promotes the breakdown of stored fat. This not only aids in the weight management part, but also reduces inflammation. Exercise has been shown to increase the production of anti-inflammatory substances in the body, further counteracting the effects of pro-inflammatory proteins. Stress management and prioritizing adequate sleep is another key aspect of pain management. These factors play pivotal roles in our overall well-being and pain perception. Chronic stress has significant negative effects on the body, including the release of stress hormones like cortisol. Elevated cortisol levels can lead to a range of detrimental outcomes, such as increased inflammation and unhealthy coping behaviors like overeating and physical inactivity. By actively managing stress through relaxation techniques, mindfulness, and stress reduction practices, you can mitigate its impact on your health and pain levels. Sleep is also a critical component to the body's natural healing process. During restorative sleep, the body repairs and regenerates tissues, including those involved in pain response. Inadequate or disrupted sleep can heighten pain perception and exacerbate inflammation. Ensuring you get enough high-quality sleep each night is essential for managing pain effectively. So by adopting positive behavioral and lifestyle strategies, you can effectively reduce excessive adipose tissue buildup and mitigate the production of pro-inflammatory proteins. This in turn helps alleviate joint and body pain while also reducing the risk of developing serious medical conditions associated with chronic inflammation. Embracing a holistic approach to health can lead to improved overall well-being and higher quality of life. Well, I hope you enjoyed this episode of Physio Show. Your support truly means a lot to us, as it helps us continue sharing valuable insights about your body, how it works, and what it needs to keep moving. Thank you for being a part of our community, and stay tuned for the next episode.